Hello. Today we're talking about shoulder pain. Shoulder pain is a very common ailment that affects many of us. Now the key with shoulder pain is to determine what is chronic shoulder pain, what is acute shoulder pain, what's going to get better and what's not going to get better, and when you should see a physician regarding your shoulder. First off, I wanted to show you a little bit about the anatomy of the shoulder. This is a right shoulder. This is the collarbone in the front of the shoulder, also known as the clavicle. This is the bone in the back of the shoulder, called the acromion. This is the scapular spine in the back of the shoulder. This is the shoulder blade. And these are the muscle tendon units that surround the shoulder, called the rotator cuff. There's the subscapularis in the front, the supraspinatus up top, the infraspinatus in the back, and the teres minor in the back inferiorly. So it's four tendons that come together and insert over this ball and socket mechanism of the shoulder joint. This is your humeral head, which is the ball, and inside here is the socket. What gives you mobility in the shoulder are these group of tendons that all attach on this bone. In the front of the shoulder is this noodle-looking thing. This is the biceps tendon that runs up the front of the shoulder and inserts deep within this socket mechanism. So regarding the shoulder, the first type of problem that we can discuss with the shoulder is something called bursitis, which is very common, which just means that this rotator cuff mechanism, there is a lining above it between this tendon and the bone called a bursa, which is a fluid sac. That allows you to have mobility in the shoulder and it's almost like a lubricated fluid-filled sac that allows this rotator cuff tendon to slide underneath this bony structure here. Occasionally that bursa gets very thickened and inflamed and creates a bursitis. Oftentimes, a bursitis can be treated non-operatively with things like exercises, injection, modification of activities, and sometimes an anti-inflammatory. That will typically calm this down 98% of the time. So as always, do your due diligence in picking your surgeon, discuss your surgical options, and never ever hesitate in asking for a second opinion. If you have any questions regarding any of these issues, please feel free to contact my office. Thank you.